All right, so welcome everybody to today's webinar about implementing Nav-CARE, volunteer-based compassionate community program. Thank you so much to all of our wonderful panelists and the team from Nav-CARE for putting on this webinar. And for everyone's information, the webinar will be recorded and the video and the slides will be made available to everyone afterwards. We'll be sending that by email in the next day or two. If you have any questions, please put them in the chat. We will be monitoring the chat to make sure that your questions get addressed. And so feel free throughout the presentation, if you have a question, to just throw it in the chat and we'll make sure that we get to it. On that note, I will hand things over to Barb and enjoy the lovely webinar today.
Good. Well, we're delighted that you're with us here today. Our topic today is providing an introduction to the Nav-CARE program. And before I do that, I would like to introduce the team that's here with me today. I'd like to introduce Hope McNally, who's from Grand Prairie Palliative Care Society, Brenda Hooper, who's from the Greater Trail Hospice Society, Louise and Anitra, who are from Thérèse Delare Palliative Care Residence in Montreal, and Dr. Gloria Pervine, who is the project coordinator for Nav-CARE. So we're delighted to have you here today. Life is just so much more interesting when we have a group of panelists who are actually involved in doing this thing that we're going to talk about today. So thank you. So our session outline today, we have about an hour. We're going to talk first for a few minutes about what is Nav-CARE. Then we're going to talk about some key considerations to implementing the Nav-CARE program. And then we're going to provide you some details about a funding call that we have available to actually develop Nav-CARE hubs across Canada. So our learning objectives for this session are to have a better understanding of the Nav-CARE program, to have really learned probably the 5 considerations that organizations need to think about before they think about taking on a Nav-CARE program. And here's where our panelists are going to really help us in this. To envision how these considerations can be applied to your own organizational context, and then to learn a bit more about the funding opportunity we have available. But before we begin this presentation, it's just such a privilege to acknowledge our funders. Nav-CARE has been in process for probably 10 to 12 years now, and we have just had such wonderful funder partners along the way that have helped us to get to this point. And I particularly want to acknowledge Health Canada today. Health Canada are the ones that are providing the contribution to develop Nav-CARE hubs across Canada. And of course, we also have to acknowledge those that have participated in the many research studies that have gotten us to this point. We are just so incredibly grateful to the volunteer navigators, to the coordinators, to the participants in our studies who've just shared their learnings with us. We wouldn't have this program without them. I'd like to begin describing what we try to do in Nav-CARE with a story. And this is a real story. It's the story of John. I met John in his early 80s. John had been married to the same woman for 60 years, and he had been her caregiver as she was living with dementia for about 5 years. And they were doing so well together. He had really learned how to do this together as a couple. And one day he fell and broke his hip. And of course, John ended up in acute care, and because he was the primary caregiver of his wife, she ended up in acute care as well. During the time that he was in acute care, she actually passed away. And I met John for the first time when he had returned back to the place that he had shared with his wife for many, many years. And when he met me at the door, he was having mobility issues. He clearly was having difficulty just doing the activities of daily living. He was very sad and bereaved. And of course, most of all, he'd lost his meaning and purpose in life because caring for his wife had been such a significant part of his life. And, you know, John was kind of at this fork in the river. He was either going to travel sort of a trajectory of toward death, or he was going to find new meaning and purpose and get engaged in life. And here's where we think the role of a volunteer is so incredibly important. Volunteers during these times can come alongside people, can help them get re-engaged with life, and to help them get access to the things that they need. So the goal of the Nav-CARE program is to provide specially trained, mentored, and experienced volunteers to work with persons and their families living with declining health to improve their quality of life. Nav-CARE, we think of it as a compassionate community program. So we have one of the panelists today who's working with the Compassionate Community Initiative in Montreal. Nav-CARE is really one program that you can implement to help realize that compassionate community mandate. And I just love this quote from the BC Centre for Palliative Care. Living in a community that cares for each other makes us happier, keeps us connected, and helps us to find meaning in life. So here are the goals of the Nav-CARE program. Nav-CARE was designed to be very strategic in keeping with the goals for palliative care in Canada. And I think the first thing to focus on is that really Nav-CARE is all about quality of life. It's really important to realize that we're not trying to do healthcare navigation here. We're really interested in the role of the volunteer in helping those with declining health to get access to the things that they need on a day-to-day basis that really makes a difference in their quality of life. Nav-CARE was also designed to provide early palliative support. So, many of us have heard of the palliative approach to care. This is one program that you can implement where volunteers get involved early with people to provide social support and companionship, and perhaps even at a time when they're not traditionally involved with palliative care services. A second goal is to really help to build volunteer capacity in Canada. Every major policy report that we've had really emphasizes the critical role of the volunteer in care. We have wonderful volunteers across the country. And one of the goals of Nav-CARE is really to provide a mechanism to really build that volunteer capacity in a new role and perhaps even with a broader population base. The third goal is to really optimize the available resources. Prior to the implementation of Nav-CARE, we did a number of studies in rural areas, and what we were absolutely amazed by were the number of resources that existed in every single community that very few people knew about. And so one of the goals of the Volunteer Navigator is to really know what's available in a very organic sense in their particular community. And then finally, the fourth goal is to really build social connection and capital. All our palliative care reports that have come out have talked about a top-down approach and a bottom-up approach. And that bottom-up approach is really all about social capital and connection, answering the question of how is it that we mobilize communities to help care for people in their communities. So those are the four goals. So what do Nav-CARE volunteers do on a daily basis? Most importantly, they develop relationships with persons. They really have the luxury of time that many in healthcare don't have to hear the stories, to share a cup of tea, to take a walk. And so it's really first and foremost a relational model of care. They have the ability to assist with tasks that persons with declining health may find challenging to navigate, the very practical day-to-day things. They help them find the resources and local services that assist persons in meeting their daily needs. They listen as persons make the transitions and decisions that arise out of declining health. And probably one of the most important things is they provide a safety net for those living at home alone and without family nearby. The volunteer provide a continuous connection, whether in person or by phone, so that they can, just kind of make sure that these people are okay in the community on a continuing basis. And now I'm going to turn it over to Gloria.
Thank you so much, Barb. And before we move on and to think about these 5 questions, I wonder if anybody had just a quick question for Barb before we move on. I'll just give you a moment or so to pop something in the chat if you need to. All right, so for the duration of the presentation, we're going to walk through five questions we ask organizations to think about when considering implementing Nav-CARE. And I'll close that off by finishing the presentation by talking briefly about the funding call. So how this will go is I will introduce each question and topic, and then we'll draw upon the wisdom from our panelists who come from 3 hubs who are currently implementing Nav-CARE, and each coming from a different place in their Nav-CARE journey as well. So they're going to provide you with some tangible, on-the-ground examples of the different things to consider when implementing Nav-CARE. And I just want to thank Brenda, Louise, Hope, and Anitra for joining us today. I think it's one thing to listen to the program project managers such as myself talk about this, but it's totally another story when you hear folks who have the on-the-ground experience with implementing this. So without further ado, I'll go to this first question. Oh, look at that. So really thinking about whether if Nav-CARE is a good fit with your organizational strategic plan. So as Barb really eloquently articulated, Nav-CARE was designed to fit with important directions in hospice palliative care identified by palliative care leaders in Canada, the palliative approach to care, the community, compassionate community approach, optimizing the work of volunteers, hospice organizations' role in educating the public about palliative and end-of-life care, and hospice palliative care organizations' role in reaching a variety of people, and including those who are at risk for social isolation and loneliness. So in thinking about Nav-CARE, whether it is a good fit with the organization, I'm going to just quickly stop sharing so you can see the panelists a little bit better, and I'm going to pose a question to them. So I'm going to first pose this question to Louise and Anitra, and then followed by Hope and Brenda, if you could answer this as well. So how has Nav-CARE aligned with your organization's strategic directions? And can you give some examples of what that looks like?
You want to go first, Anitra?
So we're a palliative care residence, right? And we are embedded in our community. The people who come to us for end-of-life care have been members of the community and use us as a resource. And so the Nav-CARE program sort of seemed like the next natural step in our ability to be able to give back to the community. We're very lucky. We have about 265 volunteers that work for us, doing everything from patient care to reception to everything. And then obviously through COVID, things have been a little bit more challenging. But through compassionate communities and the work that we're doing in compassionate communities and developing outreach into the community, Nav-CARE seemed like the natural progression for us to be able to bridge for people who are not necessarily ready for palliative care, but needed additional services in the community. And having volunteers that are aware of palliative care is just an added bonus.
Beautiful. Thank you. Louise, do you want to add to that?
No, I totally agree. It was a beautiful way to, Anitra is responsible for compassionate communities. So it was really an opportunity to have a program that's been up and going for at least 10 years and make it part as a compassionate community program for the residents. So as Anitra said, a beautiful way to go out in the community.
Thank you. I really appreciate what you said, Anitra, about the opportunity to give back to the community. And that's a real powerful way to position hospice palliative care organizations within the community and thinking about that reciprocity there. Hope, I'm wondering if you had anything to add.
I do. Before Nav-CARE, we knew we needed to change our game a little bit, because we partner with a local hospice. We have a 10-bed hospice here in Grand Prairie. We are quite rural when it comes to a northern city. And we found, but by the time people found out about us or got to us, they had actively dying family members or were actively dying themselves. And we could give them so little support in comparison to what we could give them earlier on. So we were trying to develop something, and then Barb and Wendy came along, and they were what we were trying to come up with. They just had it, and it was great. We've been using it for a few years now, and honestly, we've gone wild with it. It's been fun. It's really involved our community. It's such a lovely thing to be doing.
Thank you so much, Hope. Now, Brenda, you come from a very different position in the sense that you were with Barb and Wendy in the development of Nav-CARE pretty much from the get-go. So I'm curious about how you thought about Nav-CARE aligning with Trails strategic directions.
Yes, we participated early on in the research, but it was only just kind of a trickle. So we had 3 volunteers and 6 or 8 clients that were participating in the research early on. And then when that phase of the research ended, we took the program into our own, as a program of our own society. And but we had we're a small area. We have about 23 volunteers at the moment. Total. That's all our different kinds of volunteers with our hospice society, bereavement volunteers and friendly visitors and sort of bedside vigil volunteers and Nav-CARE. Many of them are kind of trained in. They do a variety of those different things. Our catchment area is about 15,000 people, so we're quite small. We don't have our own beds. We have, an office, and we kind of ooze out into the community as, in whatever way we can help. And so we were able to just kind of start with a trickle, and not, but the program accommodated that. We didn't have to grow too, quickly or have, too many volunteers or more referrals than we could handle. One of the things that we were worried about is that we might be inundated with referrals. But that hasn't happened. There are more coming now, and it's better. There weren't enough for a while, and as opposed to being a tsunami. So that's been good. I think the goals of our society were to begin to work upstream with people, not just doing last minute vigils. Nothing wrong with doing that, but working more upstream and to provide a better volunteer engagement experience for the volunteers, and that's something that Nav-CARE, I think, does in spades. That it, on the whole, the volunteers are able to be engaged with their clients over a period of time, and it's quite satisfying for them.
Lovely, thank you so much. So I'm hearing, the ability to sort of reach out and give back into the community as being part of an organization's strategic direction, but also thinking about more upstream approaches to serving the needs in the community, and Nav-CARE being able to sort of support a program to grow in the ways that fits with that organization as well. So thank you so much for those thoughtful responses. I'm going to share my screen again and go to our second question. So the next question we ask organizations to consider is whether you have the capacity to start and sustain a Nav-CARE program. And Brenda kind of touched upon that already, and thinking about the size of her organization and the size of the community that in which the organization is situated. So the couple of things that we ask people to think about is about your volunteer pool and whether you have a sufficient number of volunteers to support the Nav-CARE program without depleting your current pool. You want to keep the volunteers able to do to do this work and not stretch them too much. And so, and again, like Brenda talked about, whether the volunteers want to work with clients over a long term, thinking about more of that upstream approach. The second aspect to think about whether you have capacity to start and sustain is about the organizational stability. And something that Barb and Wendy's research has really revealed is that this stable leadership to champion the program during the implementation phase is really, really important. And rapid change can leave limited resources for new initiatives such as Nav-CARE and well, I guess, or the organization overall. And then also to think about the other kinds of programming that you that's currently in place or that you are thinking about in terms of whether it influences your resources to be able to start and sustain a Nav-CARE program, because Nav-CARE really does require dedicated resources, especially in the implementation phase. The third question that we, before I move on to that, I just see that there's something in the chat. Oh, no worries, Kimberly. Nice to see you that you're here. All right, so the third question centers on, sorry, I have to click there, whether there are persons in your community who need Nav-CARE. And it's really important to, as part of your planning for Nav-CARE, is to identify that group of people who you're seeking to serve, who you want your volunteers to connect with. And this can be, you know, your current group of clients that you serve, or you're reaching out to different populations. So, and then once you've sort of identified that group, really important to start developing those strategic partnerships, just to be able to support that ability to make those connections between your volunteers, the persons who need it, and the persons who need these services. So essentially, it's really developing relationships with key stakeholders, educating them about what you offer, and then negotiating capacity. So I'm going to turn off my slide share. Hopefully this is not too crazy making, but I'm going to turn off my slides again and then pose some more questions to our panel. So I'm going to pose this question first to Hope. So who in your, and I'm particularly interested, I'm putting you on the spot a little bit, Hope, because you're in Grand Prairie and it serves Northern Alberta, and you've got a large area that you're serving. And so I think that would be really interesting to talk about this. So who in your community are you serving, and how did you develop those partnerships to reach these people, especially people in geographically diverse areas?
Well, it's kind of, you know, I have to start with Nav-CARE is kind of like that saying, if you build it, they will come. And we've been very fortunate in that way. Our communities, our Grand Prairie itself and our rural communities are very, very hungry for palliative care supports, and they're also such a compassionate, we also are involved in compassionate communities, and everybody is willing to pitch in and give back and help and support. So we found that it has been, of course it's work, but it hasn't been as difficult to come by as we had initially intended when we first talked with the original Nav-CARE team. As for who we engaged, we started talking with the nursing staff, the doctors, especially the home care nurses, because they are very much lacking supports in the communities for the home care. And like I said, we brought it up and they're like, come in. And then they're like, can we tell you about somebody else? So we've been passed around and asked to, and we're thrilled for that. We're absolutely thrilled for that. We have quite a young population here in the north. I think our average age is about 36. And our average age in hospice, which is kind of, I keep stats on our hospice, and 23% of the population in hospice in 2020 was under the age of 60. So we knew early on that we needed to reach out to the younger demographics too. Boy, can I rant. I just carry on. So as for finding people, and same with volunteers, a lot of feedback that we had in the past or with the rural communities that we work with was, how do you engage the younger populations? And we've been very fortunate with that too. Like I said, Nav-CARE is very much, if you build it, they will come. Yes, there is work to it, but it's too good. It's feel-good work.
Lovely. Thank you so much, Hope. And I think that's a really important demographic that to talk about, is that younger population. And so I appreciate you raising that. Louise and Anitra, would you like to respond to this question? Who in your community you're serving? You know, you're in a large urban environment, which is quite different than where Hope is coming from. And so
it's interesting. We focused sort of on, for our Compassionate Communities program, we focused on 3 communities that surround the residents. And we've done that strategically because most people in the community know who we are. So it was easier to go out into the community and talk about the services we offer and have them say, oh yes, I know somebody who's been there, or a family member, or you're already ingrained in the community. So that was it was a more strategic move. And also because the area is quite large, we had to kind of narrow in, because otherwise the territory becomes too large. So in the 3 communities that we're in, we're average about 100,000 in terms of population. About 45% of that population is over the age of 65. So it's definitely a senior population. And what's interesting about the demographics is also that it's we've got more than 70 community organizations that offer a wide variety of community services that we are able to work with to find and resource for people within the community. And another interesting one is that there are 45 houses of worship in the territory. So it's, which is quite significant. Some are, very active, some are not. And, but it's just sort of gives an interesting perspective on who the demographics are and that type of thing. So
thank you so much. Louise, would you like to add to that?
Yeah, so we decided also to not only offer it to elderly people, but anyone with chronic illness living in the community and their caregiver. And so we had decided that we would also service if anyone, for example, has cancer, but the option of having treatment is no longer possible. Well, that is someone that we would offer services to. We were really lucky too, because when we went out, as Anitra said, we do have a lot of resources in the community, but I think we were good. I guess we did a good job in showing the community what we could add, and that it wasn't, the goal was not to replace anything that's already existing, but more an opportunity to connect those dots, to connect the information and share that information with people in the community. So when we presented, and we really went to community organizations, we also went to what we have here is a C3S, which is a Centre de Santé de Services Sociaux, our healthcare system, met with municipalities and also with a lot of the municipalities offer services. So presented to them and really put a lot of emphasis on what we could add, and not with the goal of replacing, but more in the goal of supporting what's already there, and continuing that work with members of the citizens in the community.
These are all like complementary services.
Yes.
Yeah, and I think that's a really important point to reiterate. It's about of talking about the complementary role versus that it might be in tension or in conflict, and which speaks a lot to knowing what is out in your community, how to reach those people in your community, and making those connections. So I'm just going to turn it over to Brenda. And I wonder if you could speak a little bit more to how you've developed in your small community these types of partnerships you needed to be able to reach the kinds of clients that you wanted to reach. You're still on mute.
I think that initially that we got a lot of our referrals from a partnership, being part of a palliative rounds, which is in the community, so we would find that we were able to support people who were not really needing the community services very much, like home nursing care and those kinds of things. They were early on in the trajectory of their disease. So we were able to support them when other people that attend rounds were not yet able to have much. They didn't have physical needs very much, or those kinds of things. But it's interesting with COVID, we've also started having referrals, being able to work with people who are isolated, elderly isolated, and isolated in the community much more than we have before. And the other thing that we're seeing is that there are some of those people are asking for information or help in developing an advanced care plan. And so that's how we begin the navigation relationship. But it's now, once that's established a bit, then the navigator is able to carry on. Before, people would say, "Oh, I don't need that right now, but I would like some information on advanced care planning." So that's been an interesting development over the last half a year, I guess. Mm-hmm.
Wow, that's super interesting. Now I'm going to take a question from somebody, from Louisa Christian, because I think it fits well with your thoughts around becoming part of the palliative rounds. And so Louisa asks, what resistance did the implementation of the Nav-CARE program experience regarding support from the clinical teams? Was there resistance from them in regards to the volunteer working with patients? And some feedback from volunteers working in our IPU unit felt their role was not always respected as it should be. How have you managed these relationships? And I'll open it to anyone on the panel to jump in. And Barb, if you want to respond to that as well. So anybody have thoughts about that?
I can put a little bit in on that. There was a little bit of resistance in the beginning, more so unsure, right? They were unsure if our volunteers had the same basic onboarding at working with the facilities. So what we did is we paralleled our onboarding process of our volunteers to their expectations. And then we added on top of those expectations so we could really make our volunteers shine. That was the first hurdle that we had to work with when we were working directly with the healthcare system. And then the other piece that you brought up about the volunteers not being valued. That isn't quite the words that was asked in the question, but that's the piece that I can speak to. is we came across that too. And what we did is we built a mentoring program so that if we were setting them into a situation where we thought that there would be misunderstanding of what their role was, we would send them in with somebody that was more senior. And if we were fortunate enough, there was many occasions when we would send them in with somebody who previously had worked in that field, because quite a few of our volunteers are retired social workers or retired nursing staff, or retired healthcare aides, which gives us the opportunity is they're already embedded in that environment, even though they've retired or they're working part-time. So the mentoring piece helped us with that hurdle, but that is an ongoing hurdle. But I think that the way that we combat it day to day is education and awareness and, open conversation.
Lovely. Thank you so much, Hope. Anybody else have something to add there? Okay.
I think that, initially at one point we had some resistance from it was a new social work position, a palliative social work. And she was at that time trying to kind of establish her position and eke things out. And we were quite excited about having her because we felt that, we needed that for the more complicated cases or situations that needed to be sorted out. But we knew that the Nav-CARE volunteers have the luxury of time of being able to spend time with their clients, spend time over time, and that the social worker would be quickly inundated with so many cases. And so when that happened, we're now able to work in quite complementary partnership. Yeah.
Cool. Thank you so much. So I'm hearing things about to sort of navigate those relationships, as you mentioned, Louisa, about the importance of mentorship, about education, and really sort of reassurance to those within the field, or the professionals in the field, that this is a complementary role. There's not taking over any of the profession's duties there, and that the volunteers have that gift of time to be able to work with clients over time, as you so nicely said, Brenda. So I'm bearing in mind time, and we're going to move on to the next question that we'd like people to consider. I'm not going to share my slides right now because it's just such a basic question, but one of the most important questions to think about. And that is underscoring the importance of a volunteer coordinator. And Barb and Wendy's research over the years have really showed the importance of that they have learned that the volunteer coordinator is the single most important factor in whether Nav-CARE will succeed or not. And I am just going to pose this question to one person because in the notions of time here, I am wondering, Brenda, because you have the longest experience, time is becoming a theme right now, the longest experience with Nav-CARE. Can you speak a little bit about the volunteer coordinator and the role and that sort of the importance of that volunteer coordinator in the success of Nav-CARE?
I think, well, it is very important to have that consistency because and have someone who is a champion for the program. And when you have staffing changes, of course, everything is new and people are trying to kind of figure out their job. And so Nav-CARE is just can be just one of those things on the side of their desk. And so it's really great right now to have someone who this is what they do. We our our society has another part-time care coordinator who manages all the other kinds of referrals, but having the Nav-CARE person coordinator right now dedicated to Nav-CARE has provided that consistency. So yes, it's been a very important piece. Yeah.
Thank you so much. And I really appreciate that word consistency. And, you know, I have had the pleasure of working with you folks over the past number of months, and just hearing you talk about your, and meeting the volunteer coordinators and and seeing the work that they do, and the consistent work that they do. They're able to have this dedicated time to dedicate to Nav-CARE. It's been really, really important. So then I'm going to share my screen again, and we're going to move on to the final question. So we're really then thinking about whether Nav-CARE can be sustained over time. And there's a few things to think about here in terms of sustainability. And it does link up to that first question about whether Nav-CARE fits with the strategic plan of your organization. So that first part, thinking about the vision of your organization, what is Nav-CARE doing to fulfill the needs in your community? How does Nav-CARE fit within the next 5 years of your organization's vision, or the next 10 years? And what do you hope to achieve over these number of years as a result of implementing Nav-CARE? And the second part to sustainability sort of rests on the kinds of resources needed. And everybody talked about, that dedicated volunteer coordinator, but there's other kinds of resources that are needed over time. So what kinds of resources and partnerships are needed to meet your vision? And does this have any funding implications? So how are you going to sort of support that vision to be realized? And then finally, thinking about how Nav-CARE meets these strategic policy directions for your organization in your community. So for example, as Anitra and Louise talked about, that compassionate community approach to care, for example, and whether there are necessary changes to support the development of necessary changes to policy that to support the development of the program. So back to the panelists, and the question that I'd like to pose to you is, how are you seeing Nav-CARE in your organization being sustained over time? Sustainability is a big issue, and we see, programs kind of come and go over time because they are not sustainable. So how are you thinking about sustainability? And I'm going to ask this question first of the folks in Montreal.
The first reaction I have when I hear that is to become top of mind. So to really be out there, continue developing partnerships, relationships with organizations, and really becoming top of mind when there's a need. So having more and more partners, and also being more and more visible. So through social media, through town halls, through connections, just keep growing slowly but surely towards becoming top of mind as a support to the community.
I love that phrase, top of mind. Thank you. How about for you, Brenda?
Well, it's just a continual process of talking to the community, and we find that if we don't get out there and talk to the community, then our referrals drop off. So having someone that can be doing that for this time is really important. Yeah, top of mind would be a good phrase for it. Yeah.
Thank you. you. And Hope?
The same thing, you know, it's really word of mouth and being out there and being helpful and being open to being flexible might be another piece to add to that. You know, the lovely part of Nav-CARE is it gives us the opportunity to, for us, especially considering where we're located, we need to be outside of the box. We need to be flexible, and the support that we get with Nav-CARE from Nav-CARE itself, but also from our community, really the flexibility piece and the out there and talking and having a dedicated person that the community gets to know and trust.
Thank you. Top of mind and being flexible. I think those are the key messages for sustainability. So can you also sort of envision or speak about any partnerships and policy directions? Well, let's talk about like policy directions that might help sustain Nav-CARE over time. And Brenda, you kind of touched upon one kind of about, you know, infusing volunteer coordinators in the palliative care rounds. But are there other ideas where policy directions could help sustain Nav-CARE over time?
I'm not sure I have an answer there.
That's all right.
I think if you don't mind my jumping in my spare time, I'm also a city councillor in my municipality, and so working with the municipalities and with community organizations is really paramount to the success of any kind of volunteer-based program, especially that's going out and reaching out into the community. And you know, just the age-friendly cities component and adding Nav-CARE to an age-friendly city is probably it. Then it becomes woven into the policy of making sure that services are available. So complementary services to healthcare, right? That communities and municipalities and smaller organizations are able to refer people back to a program where they will get the services or additional support that they need in the community. So I think that's where it's sort of a backwards way of going into creating policy. But once every community it identifies itself as an age-friendly city and checks off all the boxes, Nav-CARE can easily kind of fit into that checkbox of things that they can offer within the community. And it doesn't have to be a big scale, right? Like it could be very small scale, but it is complementary to the services that are offered by other community organizations. So.
Love that idea. Love it. Hope, do you have a quick few things to add?
I'll be quick. Yeah, actually what you brought up, Anitra, is very true. We talk with our municipalities and our council members at very least once a year. And we actually bring a volunteer with us, like in the past, we brought a volunteer with us, or we take them testimonials. In the beginning, we weren't sure how to gather testimonials, but really and truly, people are so thrilled with the support they get through Nav-CARE that it's quite simple once you kind of get the courage up to say, hey, could you tell your story? And quite often, you know, you give them the option to say no, but quite often they're like, yes, I most definitely want to tell my story because I want somebody else to have the experience that I had. And then when we're working with the municipalities, often we offer to try and partner with something that they're already doing so that we complement each other, like you said, Anitra, which was very well said, just to get more word out there about us, but also more word out there about what they're doing too.
I like that kind of thought about that reciprocity there, about, you know, it's about us, but it's also about them as well. So, and I think that's a really sort of honoring of the folks who are in your communities in that way. So yeah, thank you so much. So I'm keeping mind about the time again, and I'm gonna now shift our presentation to talking about the funding opportunity. And I'm going to share my screen again. So all these questions that we asked you to think about in terms of implementing Nav-CARE is to help you think about whether you would like to apply for two-year funding that's been made available to develop Nav-CARE in hospice palliative care organizations across Canada. And as Barb mentioned earlier, this is in thanks to the contribution made by Health Canada to implement Nav-CARE across the country. So we're looking to do that some more, the hub and spoke model. So what that means is the funds are going to go to one organization or a primary organization to implement Nav-CARE and in their organization and to support two smaller hospice palliative care sites. So for example, Hope in Grand Prairie, she receives the funds to implement in Grand Prairie Palliative Society, and she's supporting two very small organizations in Westlock and Spirit River to develop Nav-CARE there as well. And those two organizations are geographically far away from you. And yeah, so that's how that sort of hub and spoke model kind of works. And what we're asking hubs to commit to receive this funding is that they use the funding to hire a dedicated part-time Nav-CARE coordinator. As you heard from everyone, that the coordinator is key to this. And we're asking you to train 30 volunteers across the sites over that 2-year period and to support about 60 clients across the sites and co-facilitate 2 educational webinars. So, you know, what Brenda, Louise, Hope, and Anitra are doing right now is, you know, fulfilling one of those commitments, which is really great. And then also asking for some biannual reporting on specific indicators. And it's not too onerous of a reporting kind of requirement here. And in turn, what we're offering is $60,000 over a 2-year period to support that part-time volunteer coordinator. You get access to the entire Nav-CARE toolkit, including the Nav-CARE training, which is online. And we have a monthly hub huddle to discuss emergent issues. Excuse me, sorry. And then I provide you with some reports on the volunteers that are in training or have been trained that are specific to your hubs over these 2-year periods, and then profiling your hub in our knowledge products. And that's through the CHPCA. For example, just earlier this month, we featured the folks in Montreal and their compassionate community approach and how Nav-CARE aligned with that. And so the details of the funding, so the key selection criteria is really aligned to those 5 questions we just discussed. And the RFP form talks about these 5 questions. So really thinking about your strategic plan, your capacity to start and sustain, or do you have these partnerships in place to support the hub and spoke model? Can you meet those volunteer and client targets? And can you find, or do you have a volunteer coordinator to champion the program? So we ask you to kind of talk about these questions within this application. And so the application request for proposal, that went out in October. And the deadline for submission for that is in early March. And then we as a team, as well as a couple outside folks who are familiar with the Nav-CARE program and work with hospice palliative care, we come together and we discuss the proposals, and we'll make a decision by March 31st in 2022. And then the implementation start date would be June 1st. And there's a couple months there because we had a big learning this year, is that it takes a long time for these contracts to get set up within our UBC system. So that's the reason why it takes, there's a 2-month period there. So the application materials, including the implementation manual, which can help walk you through those 5 questions, they're available on our website, or you can contact me and we can set up a meeting, we can have a conversation, and I would love to hear from you. So my contact details are there below, and I'm going to stop sharing now, and we'll have a few minutes. Yeah, a few minutes for questions and 4 minutes for questions. So I'm just going to quickly open up the chat. So we have a question from Carla Mitchell, and she asks, what type of volunteer training is provided? Our palliative care volunteers already take 10 hours of the CHPCA program, but this may be an interesting add-on. So Barb, I'm wondering if you'll be able to respond to that.
You bet. So we have the Nav-CARE training is all online. It's 6 modules that take volunteers about 6 hours to complete. And it is the competencies that form that training are based upon the CHPCA competencies. So that training rests upon the idea that your volunteers have also had, first of all, had CHPCA training or some equivalent, and then they receive the Nav-CARE training on top of that. So it's online, it's freely available. We also provide volunteer coordinators with a sort of an affiliated manual where they can do in-person sessions that complement the online training.
So Barb, I'm wondering if you just want to briefly touch upon some of the key competencies in terms of the navigation training.
Yeah, you bet. So we teach them about the volunteer role, more specifically when they actually work with people in the home. We talk a lot about advocacy. We teach people how to identify what's in their community and some of the barriers that people may experience in getting access to those things. We talk about engagement. Engagement is a really big part of what we do. How do you help people stay engaged with life according to what's meaningful to them? And we have a brand new module on virtual navigation, because of course, many of us have had to work virtually now because of COVID. So those are just some of the competencies that they get in this additional training.
Thank you so much, Barb.
We have our 3-minute warning. Are there any more questions? Good. Well, I can't thank our.
Hang on a minute.
You got one? Okay.
Yeah. So from Lane, in regards to the hospice sites, do these sites need to be separate entities to the funded organization? We are a visiting hospice and cover a large catchment area. We have satellite teams in 3 smaller areas where the team leads help the main office manage services and volunteers. Could these satellite teams work as a hospice site?
Yeah, we'd love to talk to you, Lane, about that. We don't probably have time today. I know we're going to get stopped in a few minutes here, but maybe contact Gloria directly. Lane, is it Lane? Yeah, Lane. And we would love to talk to you about that possibility. It does look like it might fit.
All right, so we have our 1-minute warning from Kat here. And so can I just extend a huge thank you to Hope and Brenda, Anitra and Louise for sharing their wisdom, and for everybody here on the webinar, attending the webinar. I don't see you, so it's a little bit weird. And thank you so much for joining us, and please feel free to connect with us anytime. We're very open to meeting with you and individually and having email conversations. So yes, thanks. So Kat, I'll turn it to you.
Well, thank you so much, Gloria, Barb, Brenda, Louise, Hope, and Anitra. Your knowledge and your willingness to share and present these wonderful opportunities for hospices across Canada is greatly appreciated. So a big thank you on behalf of CHPCA, and thank you to everyone for participating, for your really thoughtful questions. As I mentioned at the start, the webinar was recorded. We will be circulating that recording so that you can refer back to it. We hope everyone has a lovely day, and we'll see you next time.